What's up, everybody? This is Dr. Nick with Leverage Media, and welcome to another Ask Dr. Nick episode. This is obviously a special COVID-19 episode. We're going to be talking about. We've been talking a lot about it this past week, but I wanted to pass along some things that have been asked to me over this week as people are starting to kind of grapple with what's happening. So, first of all, I mean, this was probably the craziest week in, I don't know, maybe American history, but maybe not American history, but it's been pretty crazy in terms of my career. It for sure has been one of the hardest, and having to think about a lot of different things. I'm hoping that the government comes up with some solutions in terms of how they're going to, keep small businesses afloat. A lot of states are basically going to, shelter in place or stay at home. Illinois is like that right now. So we're dealing with that in the practice. What it seems like, though, is that the kind of the general consensus of all of these states that are doing these stay-at-home orders is they are deciding that chiropractic is, an essential service because it's helping people stay out of the medical offices, out of the urgent care, out of the emergency rooms. So there is kind of hope for staying open if that's what you're wanting to do. I know Illinois, we got guidance from the Illinois Chiropractic Society that we could stay open, and then we had to just kind of like make a decision on what level of patients we wanted to see. But it seems like most states are that way. I haven't read all of the executive orders, but seems like California, people are still seeing patients in some of the offices, and it's not like they're coming in shutting them down. So it's going to be interesting. It's changing every day. Seems like it's changing almost every hour. So we'll, obviously try to keep everybody updated as much as we can, and keep trying to bring you, interviews or content that I'm creating that I think will be helpful to try to navigate this process. So luckily you guys most of you probably didn't have to move this week. We bought a condo, and we were supposed to move the 28th. But we were worried that this order was going to come down. So we basically had to move in the span of like 24 hours. And so that was pretty hectic. So we're kind of trying to get situated at the new place. But so let's hop into these questions. So we got 5 questions today. And if you have any, we're doing this Facebook Live right now. So if you have any questions that pop up, I'll check the comments at the end and answer anything that you guys have. All right, number 1, what is the best way to be productive from home? So the interesting part is that this has doesn't seem like this has really changed my daily routine much, just because I work from home. Ever since I've moved to Chicago, I work from home, and I stay in my apartment pretty much like 98% of the time. So I only really go out for running errands. I pretty much work all the time that I'm not sleeping here. So it's a little bit interesting in that the rest of the world has definitely changed. My Zoom bandwidth has definitely changed, but in terms of my daily routine, it hasn't. So working from home can be a little bit of a challenge, especially when you first start in terms of staying productive. I remember when I stopped seeing patients, when I hired my second associate, I stopped seeing patients, and it took me about 6 months before I really kind of found a rhythm for what I should be doing every day. I almost felt guilty sometimes that I wasn't doing anything. So for those of you that are going to close your offices, or the state makes you close your office, that having a schedule, I think, is probably the most important thing, especially as chiropractors. Most of us work on a schedule in terms of we have adjusting hours, we have new patient hours, we have marketing hours. Patients usually have scheduled time appointments. So you're going to do really well if you wake up at the same time every day, go to bed at the same time every day, and break your day down into 30-minute chunks and try to accomplish one thing in those 30 minutes. So what I try to do is I have 3 to 5 things that I'm trying to get done every day. Some of those might be projects that take a couple of hours, but I try to break them down into 30-minute chunks. Do the first part of the task, even if maybe it's a 10-hour project and I'm only going to get an hour of it done today, but really make sure that you're scheduling out your day. So whatever you're used to, if you go into the office at 8 and you stay there till noon and you take a lunch, like our office hours are 8 till noon, 2 to 6. So if those are your hours, work during those hours. I kind of like those 4-hour blocks of, working for more than 4 hours, especially on like high level stuff. It can be difficult to do more of that in one day. More than that in one day. So what I try to do is I will do all of my higher level thinking stuff, all my strategy in the morning. And then I try to have my meetings in the afternoons. If I have sales calls, I try to get those in the afternoons, because those are things that I don't need as much of my mental energy for, or much of my, maybe not mental energy, but more of my like creative energy. So I try to save that for the morning, especially first thing in the morning. That's when you're going to be the most productive. You should make your plan either the night before or early in the morning when you get up. And then I like to do, what I haven't been doing this lately, but what I'm going to start doing, having to be, pretty much inside all the time, is from that noon to 2 time is be sure to eat lunch and then also get my workout in for the day. So that's going to be how that's kind of how I structure my days anyway. I just have never really been that great about taking that block in the afternoon. So that's how I recommend it, is like make a list and then make a schedule. Make a schedule for the things that you want to get done every day. All right. Number 2, what is the best way to manage people remotely? So a lot of you are going to learn the fun of managing people remotely. As somebody who runs a digital marketing agency, our employees work remotely. We used to have an office, and we got rid of that in February. But we've always had like some level of remote work in the business. With the office, it'll be a little bit different. But in terms of like whatever you have them doing, you want to make sure that you are giving them, like meeting with them each morning. I recommend doing a morning huddle. So we do that for Leverage Media. We do a morning huddle, talk about any issues that have come up, and then like what's the plan for the day. And with Leverage, everybody has like their things that they're supposed to be doing. So it's just part of like the normal course of business. But, knowing what everybody is working on and making sure that they have enough to do, being sure that they're reaching out to you if they run out of things to do. So for the first part of like, as you start to work from home and as you start to manage remotely, I'd probably recommend doing maybe a meeting in the morning and a meeting kind of like in between each, or at the beginning of each shift. So a meeting, before your 8 a.m. starts, and then, or when it starts, and then maybe a meeting at 2 o'clock, if that's how you're going to do your schedule. That way you get to check in on, how'd the morning go? Did you get everything done? Did you not get everything done? So that's probably the best way. Just communication, make sure you're setting up Slack, make sure that you are, getting a Zoom account. Zoom is even like the free, as long as you're not going more than 40 minutes on your meetings, which I don't think you should. We usually do anywhere from 15 to 30 minutes on our morning meetings. So if you've got less than 40 minutes, you can have a free account. I think with a free account, I don't think it's like HIPAA compliant. So if you need to be talking about patients, then get the HIPAA compliant one. I think it's like maybe like $100 or $200 a year. All right, number 3, what is your favorite online meeting platform? So Zoom is what we use. This is what this is. It allows you to stream onto Facebook. It allows you to have, you can upgrade to webinars. You can have your meetings on there. You can meet one-on-one with people. So I recommend Zoom. I hate Skype. I mean, every time I have to do a Skype call with somebody, whether it's like a podcast interview or if that's what they use for their like coaching platform, it just never, I think it's mainly like me, it just never works for me for whatever reason. So I really like Zoom. I think it's super simple. You can just send somebody a link. Again, you'll need to look into the HIPAA compliant version, especially if you want to be talking to patients and continuing to try to service them outside of the practice. So the other thing about Zoom is that they have a really simple webinar product. And I think it's like $40 extra a month to do up to 100 people on a webinar. So if you're going to do, exercise classes or yoga classes or nutritional things or workshops, if you want to do those things remotely, that's what I recommend. But there's lots of other, there's GoToMeeting, I think is one. GoToWebinar is the same company as GoToMeeting, but I use Zoom, so that's what I recommend. Even though all of you guys starting to use Zoom is like really screwing up my Zoom life. It used to be everything was like smooth, never any problems. Now it's like getting a little bit more glitchy. All right, number 4, is there anything you can recommend in terms of creating content right now? So obviously you want to make it contextual. Like, so if you're making content right now about, how to help with low back pain, it's somewhat helpful. I mean, people still have low back pain. Doesn't matter whether there's a pandemic going on or not. But if the more contextual it can be, the better. So maybe how you can take care of things at home. If you're not a functional medicine expert, it doesn't really make sense to start, pivoting to functional medicine. You can talk about some basics, or you can bring experts on to deliver, like nutritional advice or things that might be able to help them, get through this. But, if you've always been talking about, functional movement, you've always been talking about, sports or whatever, I would keep with that. It's just that you need to be contextual to people are now at home. They're not going to be able to get out as much. And so just be sure that you're creating content that matches with your brand, but is also going to be helpful right now. So even if you don't talk about functional medicine in your practice or don't talk about nutrition a lot in your practice, you can still give basic advice on that. And even if you just like listen to an expert and then translate that into or like maybe not translate, but get that information to your patients with your own thoughts on it. I talk a lot about newsjacking when it comes to creating content. So if if some study comes out, you don't have to have done the study. You can just give your thoughts on what the study says and why it's important. You can do the same thing with different things going on, in the news, in the world, to try to give people, a little bit more positivity of the information that they're going. I wouldn't go out of your way to try to cherry pick data that matches I've seen a lot of that lately, is like cherry picking things that's matching their narrative instead of, kind of looking at the full picture. But, just try to make sure you're giving them good information. You're being positive. You're giving them things they can be proactive about instead of just, reacting to the news. All right. Number 5, are people's Facebook accounts being shut down over immunity claims? So I got this from a client earlier this week, and I have only heard anecdotal claims of this, of an account getting shut down. And I think they're just assuming that it's about immunity claims. I don't really know. Facebook, a lot of especially if you're running ads, I think they're going to be like looking out for, boosting immunity. If you're just creating organic content, I think because it's not really going through their system in terms of like checking, like the ads go through a computer. And they might it might just have been a coincidence that the ad account got shut down. But right now, I would be worried about 2 things. I would be worried about Facebook shutting the account down, and I would be worried about your board. I know California and Texas came out with something saying specifically that chiropractors should not be making immunity claims. And I'm not saying whether you should or should not, but I think supporting is probably a better word than boost right now, in terms of just staying compliant with what's going on. But you got to kind of make that decision on your own. But I think Facebook is going to be hyper vigilant about claims. right now. And so I would be nervous about getting the account shut down. So just be sure that whatever you're talking about is backed up, by studies, is something that, is kind of in the mainstream, and it'd be hard to argue with when it comes to anything that you're going to be talking about in terms of immunity. So I think that is that's all of the questions that I had. Let me see if we've got any in Facebook Live. Don't. Okay. All right. So if you guys have any questions, please reach out to me. I'm trying to create as much content right now as I can to get this out to you guys, while also dealing with, all the changes every day and in the practice and with leverage. So please hit me up if you need any guidance on anything, if you have any questions. I do think this is the time to start leading, to be getting content out there that people can take and utilize, and have positive health strategies that they can implement right now. I think people are just nervous. I think they're scared, and I think they're looking for leadership. So the more that you can put out the truth and put out what we know chiropractic and the chiropractic lifestyle can do, I think that will benefit your community. I also think it'll benefit chiropractic when we do get on the other side of this, because I think that it's going to be such an opportunity to talk to people about being healthier, about all we hear about is that the underlying conditions are the real danger when it comes to contracting this. And so people are going to be wanting to fix those underlying conditions. I think there's going to be a lot of people that get scared straight after this. So now is the time to be getting that message out, and to be talking about lifestyle. And on the other side of this, I think that there'll be a lot of opportunity for that for chiropractors. So if you have any questions, let me know, and we'll see you on the next one.